More than 59 million Americans, that's 1 in 5 of the patients you see every day, may suffer from dry eye syndrome. Patients who experience redness of the eyes, a sandy or gritty sensation, itching, burning, even excess watering and mucus or blurred vision may have dry eye. Aging is a primary cause of dry eye, and since our population is getting older, the number of potential dry eye patients is increasing dramatically. Women undergoing hormonal changes, pregnant women, and women using oral contraceptives should also be considered high risk.
I had no idea being pregnant could affect my eyes.
Patients taking medication for hypertension, diabetes, ulcers, and depression should also be evaluated. Antihistamines, beta blockers, decongestants, and diuretics can all cause dry eye. So can long hours at a computer screen, pollution, sand, construction materials, and other hazards ever present in today's environment.
I noticed it when I jogged. My eyes gave out before I did.
Dry eye is also the #1 cause of contact lens intolerance.
My doctor told me I couldn't wear contacts. Talk about depressing. I hate glasses.
But even though dry eye is becoming very common, few patients know about dry eye syndrome.
I was having a hard time doing work up close. It made my eyes water. I thought it was old age until my doctor told me about dry eye.
Dry eye? I thought it was computer strain. I went in to have my glasses checked.
These patients rely on you for diagnosis and treatment. Diagnosis begins by asking your patients if they suffer any of the symptoms of dry eye. If symptoms exist, Eagle Vision's simple but advanced two-step system can be used for accurate diagnosis. The advanced Eagle Vision Color Bar Schirmer tear test accurately and easily measures tear volume. Each strip is tapered to fit the eye and has the scale printed on it. When tear volume passes the 5 millimeter mark, the strip turns blue, providing accurate measurement. When the color bar test shows inadequate tear production, Eagle Vision temporary collagen inserts are used to evaluate the benefits of punctal occlusion. While it's preferable to use the largest diameter that will fit comfortably, a smaller diameter can be used and even stacked for the desired occlusion. Recommended placement is slightly below the punctal ring and barely visible. Here, the collagen will provide more effective occlusion and stay in place longer. Approximately 3 to 4 days after placement, the collagen will dissolve and wash away with tears. Collagen inserts should never be placed too deeply where they may wash away prematurely before a conclusive diagnosis can be made. If the patient benefits from collagen inserts, the next step is permanent but removable punctum plugs. It's so revolutionary because the shaft is tapered to allow the plug to flex and conform to the natural shape of the punctum, creating a vector force that securely holds the plug comfortably in place. Eagle plugs are preloaded on a patented dilator inserter that makes insertion so simple you can do it with one hand. The exclusive 3-step process of gauging, dilation, and insertion helps assure your patients are satisfied with a comfortable and lasting solution. The Eagle Vision punctal gauging system accurately measures the size of the punctal opening to determine which punctum plug to use. Always gauge each punctum for best results. The gauging system consists of 2 autoclavable instruments with a gauge tip on each end, replicating the tapered shaft punctum plug. Do not dilate before gauging. An expanded punctum can give a false reading. Starting with the smallest gauge tip, insert into the punctum opening until the punctal ring is flush around the thinnest diameter of the shaft. The shank should not be inserted into the punctum opening. If the gauge is too small, you'll meet almost no resistance. If too large, resistance will be substantial. You have determined the proper plug size when the tip of the gauge moderately flexes the punctal ring going in and coming out. Now you're ready for the easiest part, the actual insertion of the Eagle plug. If needed, apply a topical anesthetic and/or dilate the punctum. Hold the dilator inserter like a pencil, being careful not to press the release button until in position. As you insert the plug, use a slight rotating motion until the base of the dome rests snugly against the punctal ring. Press the button and withdraw. 1, 2. It's this easy, and just as easy to remove. All you need is forceps. If necessary, removal of punctum plugs is a simple, non-surgical procedure. Gently grasp the plug under the rim as far down the shaft as possible with suitable small forceps. Carefully pull the plug from the punctal opening. Do not try to remove the plug by grasping the edges of the exposed rim. The Eagle Vision 3-step system of gauging, dilation, and insertion allows you to offer patients a safe, easy, and cost-efficient treatment for dry eye syndrome with no damage or scarring to punctal tissue. Eagle Vision invented the world's first punctum plug in 1974, and then after 20 years of clinical research, reinvented it with the Eagle Plug tapered shaft preloaded punctum plug. Eagle Vision is dedicated to continuing technological innovation and to helping build your practice through the treatment of dry eye syndrome.
I was starting to think I'd have to look for another job. Not much market for a computer engineer who can't look at computers.
I was really scared I needed surgery or something awful.
I'm glad I don't have to use artificial tears anymore. Those are expensive.
You can count on Eagle Vision.